moment to speak about what we would call keratolytic disease or keratosis of the zona alba. We've already got a couple short videos on treating this for horse owners, so this is an explanation of the disease process, what it is for the horse owner. So you might not recognize the name keratolytic disease or keratosis of the zona alba. That's not a name that has gotten around most of the equine community yet, unfortunately, though it should, as that would be the proper name for what we used to call white line disease. So we'll get into why white line disease is probably a wrong name for it. This would also be considered seedy toe, especially if you're in the UK. But the name we want to use now is keratosis of the zona alba or keratolytic disease, which was suggested by Dr. Simon Curtis, FWCF, as a good replacement name since the names that we've been using are wrong. So as we break down what this disease is, it is a combination of a bacterial infection and fungal infection that are somewhat symbiotic in breaking down and eating hoof wall, specifically certain portions of the hoof wall. So to know what it's eating, what we're looking at, we need to consider the foot itself. So we've got a very, very simplistic diagram of a sagittal section of the foot. So imagine splitting a foot down the middle and looking at the inside. So we're looking at it from the side, from the lateral side. We have our coffin bone and our sole. And of course, not everything's drawn on here because I've only drawn what we really need to look at, which is we have our white line here, and then we have our hoof wall, which encompasses from this outer line to this inner line. Now, for horses, that hoof wall is made up of multiple layers. So we have the stratum externum, which we typically only see near the top of the foot. It's a very thin layer of cells. Most of the hoof wall is made up of stratum medium, and then we have stratum internum, which is the epidermal or horny lamellae, which connect the hoof wall to the coffin bone. And really, they connect to the dermal lamellae, which then connect to the coffin bone. So what we're talking about for today, though, is keratolytic disease or keratosis of the zona alba. So what is the zona alba? If we're looking at the bottom of the foot, we have the sole of the foot, we have the white, so the sole, the white line. We have then the zona alba, which is a bright white hoof that is non-pigmented. And then we have the outer portion of the stratum medium, which is pigmented. Whether it's a white hoof or dark hoof doesn't matter. We can still see that this is a brighter white, even brighter than the white line, which is more of a yellowish color. So, as the name suggests, keratosis of the zona alba, the disease process eats the zona alba, which is this white portion of hoof wall that runs all the way up the wall. Now, white line stops the distal border of the sensitive lamina, so it's only from the coffin bone down. The zona alba, however, runs the full length of the hoof wall. If this were a true white line disease, it would have to stop here, which would not be as much of an issue. But because it does not actually eat the white line, which is why the name is incorrect, since it eats the zona alba, it can eat all the way up the hoof wall. However, we don't see it from the outer hoof wall because all of this is fine. So we're talking about a bacterial fungal infection, which is anaerobic. So it does not like oxygen, it does not need oxygen. It actually needs an anaerobic or lack of oxygen environment, which is perfect once it has eaten into this inner portion of the hoof wall. Now, sometimes these cases are extremely mild, and so we might remove a very small portion, one knife stroke of infected hoof wall when we're there trimming, and we don't really see it again, or we only see that much again the next time. Other cases, however, once we see a small deviation here at the hoof wall, by the next 4 or 5 weeks, it can have eaten all the way up into the upper portions or the proximal portions of the hoof wall. So it can be a very serious problem. As you can imagine, if all of this becomes hollow, now there's nothing connecting the outer portion of the stratum medium, the outer portion of the hoof wall, to the coffin bone. So we can actually see rotation or sinking simply because there's not hoof left, which is obviously not a good case. Most of the time, however, when we see this, we can treat it before it becomes too much of an issue, especially if you're treating it as horse owners, which we have a couple videos in this playlist as well, showing some of the ways to treat it. So we're talking about a disease, specifically keratolysis of the zona alba, that eats this inner portion of hoof wall. We need to open that up, clean it as much as possible, and then treat it. Sometimes that requires actually resecting a portion of hoof wall. So if the infection is up to here, we may have to remove this bottom portion of hoof wall and then restabilize the foot in some other way in order to get all of this cleaned up. If we allow the infection to continue on up, we have to keep removing foot, which is why it's vital for you as horse owners to treat this sooner rather than later. Now, as we think about this, we can break it down into multiple categories. So Sarah Logie, FWCF, in her thesis for her FWCF, spoke about keratolytic disease, although not by that name, and described it as being type 1 and type 2. So type 1 being a mechanical cause, so a deviation of some kind in the hoof wall, a crack, a split, something like that can allow this bacteria and fungus into the hoof wall. A flare or excessive flare can weaken the foot. Anything that causes an opportunity for this bacteria and fungus to get in and begin eating the hoof wall, we would consider that type 1 keratolysis or type 1 keratolytic disease. Type 2 is systemic. We see this more often in all 4 feet rather than just 1 foot, although type 1 can be in multiple feet. The type 2 is most likely going to be in all 4 feet. And it will simply have what we would generally consider a poor foot. Very crumbly, white line disease infection, or keratolytic disease infection rather, constantly being progressed through all 4 feet. Now, that brings us to another split in our categorization. Within that systemic or type 2 type of disease, we also have what I would call a superficial keratolytic disease. So in this case, it does not eat, or does not appear to eat, the stratum medium that is non-pigmented, but rather a very thin layer just inside the abaxial portion, or the outer portion of the hoof wall. And so it eats a very slim slice. Rather than leaving a cavity as it would with a zona alba type, it leaves a very thin line that is infected, and the foot simply crumbles. We might see horn tubules that are still sticking out where they did not get eaten. It is more the intertubular horn that is being eaten away at that point, and the foot is simply being weakened. It's not going to be as catastrophic as keratolysis of the zona alba as it traditionally is, but these feet won't hold shoes. They will chip and crack quite easily. Many people will blame it on poor nutrition, but rather it is a superficial form of keratolysis. which we can also treat, which again, we have another video on treating that with an antimicrobial. Typically, white vinegar mixed with as much copper sulfate as possible. The copper sulfate will kill all of the harmful bacteria and fungi, but leave the hoof alone. So it's not damaging to the foot itself, but it does get rid of the microbes. So we've got those two types. Our mechanical type, so any crack that you see should be treated. Any cleft that you see should be treated. The superficial type, if your horse simply has poor, crumbly feet, be treating it as well with an antimicrobial, as it could be keratolysis or keratolytic disease.